Here we are in Moscow on June 25th, 1991.
Still, yes.
Still. And you were telling me about your early childhood.
Well, I was born in Aberdeen in Scotland in 1929. I was an only child, and I lived in Aberdeen through kindergarten, school, medical school, and until really I joined the Army.
Were you the first doctor in your family?
Yes. Up until myself, all the male members of my father, and as far back as we can go, followed the sea. So I'm the first of the line not to be at sea. I've been at sea in many ways, but not excellent professionally. Yes.
How do you account for the going to medical school?
Oh, well, it's very difficult to determine one's motives, but I was always interested in being in biology. And I suppose the influence of my mother was very strong. She encouraged me in the belief that I could go in for medicine. And so I decided to do it. It wasn't so easy, you know, just after the war. I went up to medical school in 1946, and it's a strange thing that in Scotland in those days you could come out of senior school at the age of 16. I had gone through 6 years of what you would regard as college education by the time I was 16, and was in university before my 17th birthday. But of course, in 1946, the class consisted of 50% of people who were coming directly out of the forces. And in order for someone from school to get in, they had to sit open competition bursaries. And unless you got a bursary from the university, you wouldn't get in.
And
so
you
it
were
was quite
fortunate
tough.
to get one.
Yes, I got the first bursary and started myself off in reasonable shape at university.
Mm-hmm.
That was good.
And after you finished medical school, what happened?
Well, in those days, it's different now in that people coming out of medical school have a compulsory period in hospital. They have to spend a year as housemen, we call them. You would call them interns. But in those days, you could either do that or you could go straight into practice. What everybody did, of course, was to spend 6 months on a medical firm and 6 months on a surgical firm, and then you had to go into the Army for a couple of years. We were still on conscription. That was in 1951, you see. In fact, our year is holding a 40-year reunion this year.
Mm-hmm. So you went into the Army?
Well, we were lucky in a way in that the way the terms in the university went in those days, the medical school education was 5 years and 2 terms, just short of 6 years. It's a full 6 years now, but during the war, they ran extra terms through the summer so that the doctors came out 5 years after they went into university, and then, of course, after another year, they went into the Army, very necessarily. When I was at medical school, they took out one of the summer terms, and instead of qualifying, therefore, in the July, we didn't qualify until the December. The net result of this was that the first 2 firms we had were lengthened by 3 months each to bring the pattern back to something approaching normality. So we had 9 months as a houseman in medicine and 9 months in surgery, and of course that was very good. That sort of experience is invaluable.
Did you get any exposure to neurosurgery at that time?
Not really as an undergraduate. I was interested in the nervous system, curiously enough, right from the time when I was doing anatomy. As a neuroanatomist, was a very good teacher, and I developed an interest in neurosciences at that point, and then went on to a sort of voluntary hanging around the neurosurgical firm, and I tried, in fact, to get deferment to do a neurosurgical house job, but they were very unwilling to give one deferment from the services in Scotland anyway. Quite a number of people got it in England, So I went into the Army after my surgical job without having done any neurosurgery.
Do you remember who the neuroanatomist was?
Yes, he was a chap called Hamilton. He was, the anatomy department at Aberdeen in those days was a very important department. They had 1,000 hours of undergraduate teaching time, and you learned almost everything there was to know about anatomy. And Gilbert Hamilton was a very good neuroanatomist, a didactic neuroanatomist. It was many years before I achieved the same knowledge of neuroanatomy as I had before when I sat my second MB. He was a great teacher.
You did did go into the military then for a brief period.
Went in for 2 years.
And where did they send you?
They initially sent me to, well, we had basic training, which was partly in Aldershot, partly in the depot and training establishment of the RAMC, which was at Crookham in those days, and then partly in London. We had a military hospital actually in London on the north bank of the Thames at Millbank. So we did a little time there, and then I was posted out to Tidworth Military Hospital. There was a military hospital there. And so I served 2 or 3 months there, and then they posted me to Austria, which was really very nice. Spent the rest of my army time in Austria.
Well, it sounds very interesting. And after you came out, what happened?
Well, after I came out, by that time I was married. I married my ward sister in Austria. You can imagine it was a pleasant country and there wasn't too much to do, so young men will get up to more interesting aspects of life then. So we got married, and I came back to Aberdeen, where the next stage in training is usually to sit the primary examination of the College of Surgeons. And in order to do that, the best cram course is to go down into the anatomy department, if they'll have you, and become a demonstrator in anatomy. And that's what I did. I got, at first I did a 6 months research post with my professor of surgery, looking at hypervolemic hemodilution, curiously enough. Nothing to do with neurosurgery, but we were interested in flow improvement in small vessels at that time. And we did a lot of work on dextran in rabbits, which was quite useful later on.
It's still around, isn't it?
That's right. Blood volume estimations and so forth. And then I went down to the anatomy department. I always remember my interest in neuroanatomy was such that I prevailed on the professor, Lockhart, to let me teach 1 term of neuroanatomy, much to Gilbert Hamilton's disgust, because he thought if I taught it, nobody would ever remember anything. But I taught them some functional neuroanatomy out of Critchley's book on the parietal lobes, which Gilbert really hadn't been teaching, and I thought that was important.
Did you write any papers at that time?
No, I don't think so. We didn't start writing as undergraduates, really. And my first postgraduate paper, I suppose... Oh, wait a minute, though.
First publication?
No, my first publication, in fact, was indeed when I was a houseman. Before I went into the Army, I wrote a paper on idiopathic pseudo-hypoparathyroidism, because when I was the resident of the professor of medicine, who was a very fine man, influenced me a great deal, tried to make me a physician, we had a patient with calcification in the basal ganglia and fits. And this turned out to be idiopathic pseudo-hypoparathyroidism. And we wrote a paper about this because people were trying to exchange the calcium and normalize the calcium metabolism with a variety of drugs whose names I can't even remember now. And we treated this boy, came to the Western Isles, and followed him up for 2 or 3 years. It was quite interesting. I published that in the Lancet. I think that was my first publication.
Well, how did you get to neurosurgery then?
Well, after I'd finished primary, I went to a rotating job as a registrar. That's usually the next standard step in those days. It's a good deal more difficult now because young men don't have this natural break in the Army, so they have to go on much more gradually to the registrar grade. But we were appointed as registrars with primary. And then you are rotated through orthopedics, general surgery, various firms. And at that time, I rotated into neurosurgery. since I wanted to.
But you'd committed yourself to go into surgery at any rate.
Oh, yes.
Yeah.
Oh, yeah. Oh, I'd committed myself to go into neurosurgery. I was quite clear I was going to do neurosurgery. I suppose I was quite clear I was going to do neurosurgery from the time I did neuroanatomy.
Did you tell anybody?
Yes, I kept on telling people. Some of them didn't listen to me, but it was quite funny. I always remember an old physician, my friend of mine, Duthie, who was chief in one of the wards in the Royal when I was a resident, came down to outpatients when I was taking somebody's blood pressure, and I had the girl with a tight dress on, and I hadn't bothered to roll the sleeve up. I just put the cuff on the outside of her sleeve, you see, and Herbert Duthie looked at me and he said, "What are you going to do, Symon?" And I said, "Well, I'm going to do neurosurgery." So he said, "You'll take their hats off first, won't you?"
Oh dear. So, tell me about your training.
Well, it's still true, you know, in the United Kingdom that training is a much more haphazard business than it is in the States. You may remember the 50th anniversary of the boards when we were all asked to talk about it, and I accused the American system of really being a machine which produced sausages which at the end of a number of years were cut off, and they were neurosurgeons. In England, as Kemp pointed out to me afterwards in the succeeding speech, he wondered how anybody ever got trained at all because they went from post to post with no clearly defined schedule of training. So you picked somebody that you thought or were advised was a good surgeon and applied for a post with him. And if you were lucky and you and he got on, you would progress from being a registrar with perhaps some interruption for research if you were interested in it, to being a senior registrar or first assistant. And then if you were equally lucky, you'd be appointed somewhere as a consultant. But at no time was there any guarantee that you were going to finish the training and be a neurosurgeon, and there still isn't.
Who did you apply to?
Well, I applied to Valentine Logue, who at that time was the neurosurgeon to the Middlesex Hospital and Maida Vale. He had been Wiley McKissock's trainee and associate, but like many strong characters, the pair of them didn't get on all that well, and they were completely separate by the time I trained with Valentine. And I was advised by my Aberdeen neurosurgical friends. It was clearly impossible to train in Aberdeen because they didn't have a senior registrar appointment. There was no point in training there. Glasgow at that time didn't have the reputation that it has now, and Norman Dott was getting towards retirement, so I was advised to go to London, and since it was felt that strong personalities don't always get on well together, I was disadvised from going to McKissock and advised to go to Valentine, and a very fortunate choice it was. I worked with him as assistant and finally as colleague for over 20 years.
How long did your training take, then, would you say?
Well, I spent, it was curious in a way, in that I applied first for his registrar post, which I didn't get, but got to know him, became interested in him, and fortunately he became interested in me. And shortly afterwards, I was offered a training fellowship by the Medical Research Council and went down to Mill Hill to do some experimental physiology, which had a great influence on my subsequent career, as you probably know. That was a 3-year appointment, and I indicated to the council that I couldn't really take 3 years completely out of surgical training. So they arranged for the second 2 years that I should be a supernumerary registrar in Valentine's unit. And in fact, of course, that made me, in effect, being interested and anxious to get on with it, just a function as a registrar. He got an extra registrar, for which he was very grateful, I think.
So you actually only did 1 year's worth of research at that time?
Full time, but no, when I was a supernumerary registrar, I was for 3 days in the week in Mill Hill, and for the rest of the week and the weekends, I was in the unit.
They were geographically...
geographically separate. Well, nowhere in London is all that far. I lived in Mill Hill and commuted to Maida Vale, which was possible by car. I live further away from the hospital now than I did then.
What kind of projects did you work on at Mill Hill?
Well, I was interested in the cerebral circulation and started off by looking at the leptomeningeal collateral circulation. My first 2 publications concerned really flow in the collateral circulation determined by an isotopic flow method using radioactive phosphorus-labeled cells.
Did you have a mentor in the laboratory?
Which?
A mentor?
Curiously, not. Nobody was doing that form of cerebral circulation research. Murray Harper in Glasgow and I started off at the same time. He in the Wellcome Research Labs as a neurosurgeon monkey. He never went on in neurosurgery. And myself in Willem Feldberg's lab. I was given lab space and technical support and equipment and advice. But there was nobody doing anything like that work, so I simply jumped in at the deep end and got on with it. Mm-hmm. And that was a very fruitful 3 years, resulted in a couple of, I think 3 or 4 papers in the Journal of, Journal of Physiology, which is unusual for trainee clinicians, really.
And then how long did you spend actually as a registrar before you got a consultant's post?
Well, after I had finished that job, which was part-time as a registrar and part-time as a research fellow, I was offered, I applied and was offered a Rockefeller Research Fellowship from the Council. These are no longer in existence, really, but they were at that time very prestigious research awards, and I was very lucky to get one. So I went to America for a year of full-time research in the laboratories of John Meyer, who was one of the leading exponents of publications on the cerebral circulation at that time.
John Sterling Meyer still is.
John Sterling Meyer, that's right. And that was a very interesting period. I learned a lot. I learned in particular how modern instrumentation and the presence of apparently limitless funds greatly expedited research. I remember saying I wanted a square wave flow meter, and John getting on the telephone to the suppliers in California, and the next day it was delivered, and all I had to do was drive out to Detroit Metropolitan and pick it up.
Money's the mother's milk of research, I think.
Absolutely. Yes.
How did Valentine Logue teach you to be a neurosurgeon? What was the mechanism?
Oh, it was an apprentice situation. When I was finishing as a clinical research, as a Rockefeller Fellow, there was a commitment to whichever organization had sent you, that they would see that you had a job to go back to. And at that time, one of the first assistant posts fell vacant. And I was lucky enough to get it. So from that time on, for I suppose about 3 or 4 years, yes, about three and a half years, I was Valentine's first assistant. I assisted him at all his major surgery. Well, there were 2 first assistants, one at the Middlesex and one at Maida Vale, and the 2 of us were good friends. But at the Maida Vale, which was the busier, I spent most of my time and assisted him, and then gradually you would be given things to do. Valentine wasn't a great one for standing about watching you, but I always remember that he used to come in when you thought you were finished, because he liked to check hemostasis. And I used to say to him when, years afterwards, when we were good friends, that forever after in my career, as I hemostase, I have a feeling that there's a black crow sitting on my shoulder, making sure the field's dry.
It's interesting that you mentioned that, because, you know, the only time Bronson ever watched me operate was about 6 months before I became professor and head of the department. I think before he crossed that river, he decided he had to once see me do a case.
Well, Valentine was much like that. I know when I became a young consultant, and his colleague, he used to come in occasionally, and he would say, I never showed you how to do that. Where did you learn that? It was quite fun.
Did you travel much at that time?
Well, I always had the feeling that I had to keep in touch with American neurosurgery, really, because I had, by that time, made a lot of friends in the United States. Bob Knighton in Detroit, Stephen Gurgen in Detroit. I had a sort of distant and awesome acquaintance with Larry Poole, and used to go and watch him. And I very nearly managed to watch the well-known Bostonian Poppin. But I got there too late and he'd finished.
He was a quick mover.
He certainly was.
So then, after you finished your training, you stayed on with Valentine there at Maida Vale.
Well, it wasn't quite like that. When we were increasing, Valentine decided that he could at last bear to have a colleague. He'd refused all thoughts of having an associate up till that time. And if he ever sees this tape, he may disagree with that, but that is in fact the way it was. And I was offered...
Very few people will probably see this tape.
Well, anyway, I was offered a number of sessions from, I had to apply for them, of course, from the National, but they were conditional, more or less, on the Medical Research Council offering me laboratory facilities, because the National were anxious to, and Valentine was anxious to get the bones of an academic department started. So I started off, I think, with about 3 or 4 clinical sessions, and the rest of the time I developed and ran a circulation laboratory, paid for by the Medical Research Council, who eventually put me on the external staff. So I was both a consultant neurosurgeon and a member of the external staff, the MRC. And that went on, really, until Valentine retired. In the meantime, he had been given a titular chair in the university. Did me a great favor on one occasion by describing a letter that I'd written to him of a referral, describing to Valentine as the best letter he'd ever read from a young neurosurgeon. Wasn't that nice of him? All right. Well, as I was saying, the Valentine ran the Department of Neurosurgical Studies, as it was called, as a titular professor. And in the meantime, money had been raised for a formal university department, which was to move to the newly built institute. So, of course, a formal chair had to be advertised, and Valentine decided clearly he wasn't going to be interested, and retired, and I was appointed, and that's when I became professor and chairman of the department.
When was that?
That was about 15 years ago. 15 years ago now, this being 91.
Who else was there with you besides just you?
No, by that time we had another post as a senior lecturer, and we appointed David Thomas from Glasgow, who was a senior registrar in Glasgow. He had interests, as you know, in neuro-oncology. So the pair of us started the department more or less together. He, as a neuro-oncologist interested in brain tumors and cell cultures and so forth, and myself continuing to run labs concerned with cerebral circulation and metabolism.
And the physical plant was where?
Physical plant is in the Institute of Neurology, which is next door to the hospital at Queen Square.
Was this new building?
The institute was a new building, yes.
But the beds were in...
The beds were in, well, we had split beds. We had beds at Maida Vale and beds in Queen Square. And what we did, David ran the beds at Maida Vale and had, I think he has 4 beds at Queen Square, and the other 16 beds at Queen Square I used.
How did you divide your time surgically and investigative at that time?
Well, increasingly, it became, for a few years, I continued doing actual hands-on laboratory research on primates 1 day a week. But that soon became physically impossible with department administration and with the increasing demands of surgery. And so I was reduced, as most department chairmen are, to supervising groups and not actually doing any hands-on research. I spend part of every day in the institute, of course, because my office is there. And now that I've reduced my operating schedules from 3.5 days a week to 2.5 days a week, I spend rather more time there, but I'm afraid it's mainly in editing and writing books and this sort of thing. I'm sure you know how time-consuming these things are.
Who's been in the laboratory? Would you count as your biggest support?
Yes, we started off by making a lecturer appointment for my associate in the MRC, who was Neil Branston. He had been with John Meyer in Houston. John had moved to Houston by that time. He wanted to come back to England. And Neil came first as a research fellow and then as a lecturer and now as senior lecturer. David started off with a couple of youngsters, one of whom stuck with him, and who has also been appointed as a lecturer. And then 3 or 4 years ago, we had another lecturer post, and I appointed a young man who had been partly trained in France. He's Yugoslavian, partly trained in France and partly working with Hallenbeck in the Naval Institute in Bethesda. And he is primarily interested in metabolism, neurotransmitter metabolism in particular. So,
you've had a fair number of young visitors who's passed through, haven't you?
Oh, yes. We have, I think, 20 trainees in the province of Rio Grande do Sul in Brazil. Most of the neurosurgeons in Rio Grande do Sul have passed through the unit at some time, either when I and Valentine were running it or subsequently. And we have regularly 2 or 3 visitors from Japan, from Nagoya and Okayama. We have visitors from China now. Everybody seems to get a lot of visitors from China. And we are fortunate in that we find small stipends for them, keep them in the penury that research fellows have come to expect. From Turkey also at this meeting, one of my young Turks is telling me that he's got a good practice now in Istanbul. That's very nice to hear.
How many registrars have you trained in the 15 years that you...
Well, we have... This year, we are hosting the Society of British Neurosurgeons meeting in Queen Square. And one of the things that I've done is to issue an invitation to all our old trainees, both laboratory and surgical. Most of them, of course, have gone on into surgery, those of them that live in the United Kingdom. And we will have about 40 people. That's about 28 and wives, a total of 40, to honor our distinguished guest. That will be Charles Drake, and also Valentine. And Kemp, if he decides to come, he's thinking about coming.
That sounds like a great occasion.
It'll be a great party.
Yeah. Do you think that your career was sort of the ideal format for a young neurosurgeon who's interested in matters academic?
I don't think there is an ideal format, and I think the more interested an individual is in research, the less you can prescribe exactly how he ought to do it. Some people, for example, deviate entirely out of what you might call standard neurosurgery and have become pure stereotacticians or practically endocrinologists if they're interested in microdissection of the pituitary, for example. And you can't prescribe ever what would be the best way for everybody. What you can prescribe is that in neurosurgical training at some point there ought to be at least a year in which the boy is taken out of the clinic altogether, sat down at a desk and asked to either carry out clinical research or to do some basic laboratory research. Not everybody is able or willing to do animal research. You can't compress the interest into everybody. But you should give them the opportunity to read round the basic background of neurosurgery. And that year, in my view, ought to come before they have become a senior registrar. If they have continued interests, then it's up to them, when they are senior registrars or young consultants, to arrange from the grant-giving bodies support to let them continue in the research field. But whatever, they should have the opportunity to do something. And that's one of the things I've always admired about American training, that quite apart from the fact that they have a guaranteed training from the beginning to the end, if you think that's desirable.
No, that's not quite true.
Well,
Lyndsay, 20% drop out along the way for one reason or another.
Yes, but if they behave themselves, keep their noses clean,
yes,
they go from start to finish.
That's right.
Which still is not generally done in the United Kingdom, but they do have to spend some laboratory time, don't they?
Oh, I think so. Yes,
and I think that's very valuable. I think that's very valuable.
But you've spent a lot more than a year at that.
Oh, yes. Well, but you see, I think that depends on the individual's interest. Not everybody wants to, not everybody has the idea that they want to spend time in basic research. And not everyone has something that nags at their mind until they've solved the problem.
Were you ever afraid that you'd lose your surgical skills because you spent so much time in the laboratory?
No, I don't think so. You see, in the laboratory, for example, I was using the operating microscope. I went to see that general surgeon in Vermont before Ghazi, and I was using the operating microscope, cannulating 100 mu vessels in the baboon's brain before I ever used it in the clinic.
So that was a plus.
Oh yes, oh yes. You know, it was for older surgeons. It was quite a task to use the operating microscope, as they couldn't orientate their hand and head quite as well. And,
Bronson never could do a case.
No.
I tried so many times, and he'd always back away in disgust.
Yeah, that's right. It took Valentine years, but he persevered at it. And I always remember Barbara Pell, who's our theatre sister, guiding his hand into the beam because he didn't know where it was.
You're how old now, Lyndsay?
61.
61, I guess. How long do you think you go on doing neurosurgery? We have neurosurgeons in New York who are mid-70s and still going strong.
I will retire. I must retire when, at the end of the academic year in which I become 65, which will be in 1995, at the end of August 1995, I'll retire.
You clean out your desk.
Well, I'll have it cleaned out long before that.
And move it and walk out.
And walk out.
And then what?
Well, then I have... neurosurgeons are obsessional people, you know. They don't like doing things that they don't do well. And there is one thing that I could do better, and provided my health is sufficiently up to it, I shall pursue it. And that's
I can't
golf.
imagine what that is.
Yes. I'm taking more time now to play golf than I used to. When we appointed a sixth neurosurgeon, they asked me, "Oh, Professor, would you give up some operating time?" Because I had most of the operating time at the National at that time. And I was nearly 60 then, so with an atmosphere of great martyrdom, I said I would give up Wednesday afternoons, which I did. And I've regularly played golf on Wednesday afternoons ever since.
Do you think that the support for neurosurgery will continue in Great Britain, or do you see everything falling down and going to pot? They say old neurosurgeons only see bad and see no future.
Oh, no, I think there's tremendous future in neurosurgery. Tremendous future in neurosurgery. I think the whole question of not necessarily brain transplantation, such a silly word, really, but the encouragement of regeneration in the nervous system, the development of nerve growth factors, the development of realistically implantable stimulating devices is going to mean that the neurosurgeon will be active for a long time. And the neurosurgery of vascular disease, despite the interventional neuroradiologists, is still going to remain very much a neurosurgical challenge. And of course, the surgery of obliterative vascular disease has taken a new lease of life with the reluctant acknowledgement by the medical fraternity that carotid endarterectomy is really worthwhile.
Well, you remember several years ago when Murray Goldstein proclaimed that the bypass study was the gold standard of randomized prospective studies. Do you think that the bypass, which in many ways is the culmination of neurosurgical skills, is really gone?
The bypass?
Yes.
I think it's, with very few exceptions, it's gone. My own feeling about it, I was never very keen on the operation, partly because I kept on losing the needles. But apart from that, our greater knowledge of how much temporary vascular occlusion is tolerable in the nervous system means that bypasses for giant aneurysms are often unnecessary, for example. There are specific circumstances where it's useful. And the difficulty is, of course, that so few are done now that people tend to lose the skill of doing them, so that probably every unit ought to keep somebody who's active in the laboratory sewing up small vessels.
Lyndsay, what else do you want to tell the posterity about. I suppose Selby will bury this in a time
Yes.
capsule somewhere, and it's going to pop
Well,
out.
it's going to be quite interesting, I suppose. Looking back, I think probably the greatest influences in my life were my professor of medicine, well, my father first, obviously, and my professor of medicine, and Valentine, and probably also Willem Feldberg, who was a great physiologist. And the most fascinating work, I think, that I've done has been the laboratory work concerned with thresholds and the capacity of the circulation to tolerate transient ischemia, the invention of the ischemic penumbra, that marvelous piece of neurophysiological mythology is also something I'm quite proud of, I suppose.
Is that what you'd like engraved on your tombstone?
Yes. Here beneath this penumbra I lie, yes. Well, maybe.
Cushing said he wanted to say,
Yes.
I closed the Gailey. I think
Oh,
that's
yes.
what he wanted on
Well,
his tombstone.
that's good enough.
Well, you mentioned your
Yeah.
father, though. Was he at sea a lot?
Yes, he was a marine engineer.
And that meant
No,
being away from home.
curiously enough, not. He'd been through the First World War, and he was fairly old when I was born. And by that time was harbour engineer, or at least one of the harbour engineer staff in Aberdeen.
So
I was
you
at
saw
home.
him?
I saw him quite a lot of the time.
Yeah. Was he a golfer?
No, he was not. He was not. He was not.
That was an acquired disease.
It's an acquired disease, yes. I suppose I owe it to a young schoolgirl who decided that she wanted to take up golf, and since I was particularly attracted to her, I decided I'd better take up golf as well. So that's how it all started.
Oh, really?
Yes.
Well,
Yeah.
keep your eye on the ball and your left arm straight, Lyndsay. Thanks very
Yeah.
much for the interview.
It's a pleasure, Russell. It's a pleasure. Yeah.